Okay, today we're going to talk about the concept of sports injury. This is our introduction unit to Sports Medicine 1, or Unit 1 as I like to call it. So you can see here you have an irate parent at some kind of sport, whether it be soccer, baseball. Parents seem to know everything more than what the officials know, so this is what you get sometimes in sports. Prevalence of sports in society. The popularity of sport has seen a dramatic increase over the years. People like sports. They want to be involved somehow, some way. There are approximately 30 million school-age children who participate in some time of sport activity. Or maybe that should say type. Instead of time, that should say type of sport activity, whether it be in school or out of school. With 7.5 million of them being of high school age, which means there are approximately 29 million parents looking like this on Saturday morning at their son or daughter's soccer game. When we say this, I mean this, right here. Boo! Hiss! So let's go back here. There's a large increase in participation over the years, okay? And it has been impacted by the enactment of Title IX. It's also been renamed the Patsy T. Mink Equal Opportunity Education Act of 2002. This law sure began leveling the playing field for men and women in athletics. Women wanted more of a chance to participate. Since its enactment, Title IX has increased female participation in sport by over 700% since the 70s. Sevenfold increased. Example right here, girls college basketball. Bonus points if you can tell me who this is in this photo when you come to class next time. With over 30 million children participation in a sporting activity each year, how many injuries do you believe are sustained? Do you have any guesses? Remember, this isn't even counting anyone in college or adults getting injured. So, how many athletes or people do we have getting injured when they're in sports? Some people don't know. They get kind of lazy and they don't even think about this kind of thing. So you kind of get like the cat here. What my friends think I do, what my mom thinks I do, what society thinks I do, what dog people think I do, what I think I do, what I actually do. So everybody's right. The Centers for Disease Control, or the ever-popular CDC, reported in the 2005-2006 injury surveillance study that over 2 million high school students are injured each year participating in sports. This required almost 500,000 visits to a physician for further care. There were approximately 30,000 hospitalizations from injuries sustained in sports. That's quite a few. However, I believe that this number is actually a little bit low. I think that many injuries go unreported and thus are not documented. The true number of injuries may be much higher because some people don't like to tell them they have an injury so they can keep going. Or the person documenting these things is not writing everything down. With this knowledge, you can see that athletic trainers and other sports medicine professionals like physicians, physical therapists, EMS, etc., how important they are now, how more important they are now than ever. Let me phrase that right. They are more important now than ever. We need people to take care of injured athletes because there's so many people getting hurt in some kind of athletic event. Obviously, as a football player, but just one area, people get hurt. As with any profession, sports medicine has its own set of vocabulary and terms that are used to illustrate different points. For example, have you ever heard this phrase? Dude, she just rolled her ankle, sick! Well, in using our medical terminology, it would actually be more like this. Hello there, good sir. I do believe this young lady just sustained a second-degree sprain of her ankle. We will begin breaking this lesson up into these different segments. can't see, but the first one is anatomical planes and directions. Second area is movements of the body. The third area is medical terminology, which is vocabulary. I apologize in advance for the hand cramps, but we are going to learn medical terminology. Wound classifications. Classification of injuries. Different types of injuries and recognition of injuries. Anatomical planes and directions. This is important. Here you got a picture of the three planes we're going to talk about. The coronal or frontal plane, which is the plane that would cut your body in half if you went from your head through your shoulders and cut your body in half all the way down through your hips and to your feet. This plane right here is your coronal or frontal plane. Then you have the transverse plane, this one right here. If you cut your body in half at the waist, that would be your transverse plane. Next you have the median sagittal plane. It is the plane that if you cut the body in half and you had a mirror image on both sides, right between your eyes, down through the nose, that's your median sagittal plane, or the midline, or the medial plane. Okay, this is something you need to understand even better. Lying, somebody on their back, they're in the supine position. If they're lying on the front, they're in the prone position. So if you're just supposed to describe how somebody was laying on the field, if they're laying on the field or court when you get to them, hey, they were laying in the supine position. That way I know they were laying on their back. Just say they're laying on their prone, they were laying prone, they were laying on their stomach. So prone is laying on your stomach, supine is laying on your back. Anatomical directions. You have the anterior, it's in the front. Your front side is your anterior. Your back side is your posterior. Posterior in the back of or behind. Lateral, away from the midline of the body. So anything from this midline, the mid-sagittal plane, anything away is lateral. Medial, towards the midline of the body. So if you're coming back towards that mid-sagittal plane, that's to the medial side. That's medial. Deep, further away from the surface of the skin, going in. Like a deep tissue bruise is down away from the skin. Superficial, near to the surface of the skin. So if you have a superficial bruise, it's like just below or on the skin. Anatomical directions. You have superior, which is above. Inferior, which is below. Proximal, closer to the midline of the body. So, I will show you in just a minute what they're talking about when they talk about proximal by some diagrams that I'll show here in just a minute. Distal, further away from the midline of the body. So getting away from the midline again. Check this chart out, okay? See this arrow pointing to the front? Because that is the anterior ventral side of the subject right here. Her anterior, her front. This is the back side, the posterior, the dorsal side, okay? Superior, see this arrow going up? It means anything above. Inferior means anything below. So if I was talking about your knee compared to your knee is inferior to your shoulder because your knee is below your shoulder. But if you switch those terms around and you're comparing your shoulder to your knee, your shoulder is superior to your knee when you use it in that sentence, okay? So remember, Superior is above, inferior is below, and it's all related to directions of where something is at. Medial, that midline, you go back towards that midline, the mid-sagittal plane. Lateral, away from that mid-sagittal plane. Proximal, closer to the midline. Okay? So when you have that midline right there, when you're standing with your feet, your hip is going to be proximal to the midline, and your foot will be distal, right here, farther away from that midline. Or your shoulder is proximal, right here. Your shoulder is proximal to the midline, but your hand is distal to the midline. Superficial, on the surface of the skin, close, okay? Superficial is deep, deep inside, like wound to an organ, wound to a deep muscle. That's deep, deep inside. Can't use the word, describe a word, so distantly inside. We will stop there for this lesson.